Sex, porn, love addiction is all about self-soothing to manage your emotions. It got set up back in the childhood development years. It's just not about sex. It's not about porn. It's all about the repeated use has set up the physiology to crave those dopamine, serotonin, oxytocin, self-manufactured drugs in the body. It's impacting women, men, children aged 10 to 75 across all the age ranges, the sexes, the cultures, the professions. It increased exponentially during COVID lockdown and impacting so many lives. The Kairos Center has created the first online comprehensive sex, porn, love addiction. It's a video on demand recovery program which you can access from anywhere in the world and begin to see identifiable changes just within 6 weeks of beginning this weekly program. Kairos means your appointed time. Isn't it your time to reclaim your life? Bring color back to life without shame. Click the link below and begin your journey. You owe it to yourself and to others. Sometimes there's trauma, pain, anxiety, stress that gets set up in the scripts of childhood that we follow through into adulthood. And I will talk a little bit about this model of counseling, of therapy called EMDR. EMDR stands for Eye Movement Desensitization Reprocessing. What a long title. And this is the most strangest thing. I'm using this model of counseling every day in my practice. And all we can say of it is it works, even if we can't explain why and how it works. When we are in deep REM sleep, our eyes are moving from left to right. And whilst moving from left to right, it is the brain processing the day's events, the week's events, the month's events, the year's events, in order to put experiences in a right place in the brain as a resource for the brain to access when it needs it at a future date. But sometimes there are experiences which just don't get pocketed and put in the right place in the brain. And so, in essence, they remain loose cannons, not fully processed, not a resource, but triggering out emotional reactions when we're reminded of those events. And this EMDR process is about us using eye movement or tapping on the body. We'll call this one the butterfly hug. It can be tapping on the legs, on the knees, in order to activate the left brain, the right brain. And do you know the most strangest thing is by doing that process, you can actually begin to heal, to process trauma, stress, anxiety, all sorts of issues that have arisen. All sorts of issues are processed that have arisen over the many years from the time that trauma occurred. And that could be 10, 15, 20, 30, 40 years ago. All we can say is it works. Come on a journey with me. And we might give you some tasters of understanding a bit more about EMDR. I use EMDR with the couples in the room together. That's really quite a new practice for many people, but it works so well where the couple can be a part of each other's healing of so much of the stuff back in the past that have their tentacles in childhood development. You know, it's important to think about the stages of change. Pre-contemplation, contemplation, preparation, then action. And after action, we now got to maintain the gain and avoid relapse. And you know, understanding which stage you are at on that journey towards change, whether it's giving up something, changing practice behaviors, negative patterns of behavior. It's important to know where you are in that cyclical cycle of change, where you are on the stages of change. Because to use the wrong tools, or to try to use tools that I give you where you're not really at action, is doomed to failure. And so let's do an exercise to identify where you truly are at in the stages of change. And it might actually surprise you that you're perhaps not at action to change like you thought you were. And that's not a bad thing to know you're not where you were or you're not where you are. Because once we identify truly where you are, we can equip you with tools that will better aid you in your journey towards action, towards change. No quick fixes in this work. There can't be any quick fixes. Why? Because when you're seeking to effect change in someone's life, you're trying to change past patterns of behavior. You're trying to change past habits. You're trying to change behaviors that typically get set up back there in childhood development that likely we all were using in the family that we grew up with. And we tend to take those same patterns of behavior into the new partnered relationship. And of course, the way we do life is often what we think to be the right way in certain instances. We might want to try and change the other person to do life more like us. But the point is, neural pathways get developed, as I said before, and they are hard to change. They take time. What you can't see, you can't change. So let's see them, and then let's put in place tools to help you stop negative, repeated patterns of behavior and instead create a new, consistent, repeated habit. Habit isn't a dirty word necessarily. We only ever use it in a negative way, but habit just means repeated practice, neural pathways. And so we want to break down an old neural pathway on this side and create instead a new positive neural pathway over here into your future. You decide on the new practice behaviors, not me. My role is not to try and create little clowns of you doing life how I think you should do life. Mine is very much to come on board as a facilitator alongside you. I'm really excited in coming alongside you. I'm really excited by the tools which you get to use. I'm really excited that right at the beginning, I can just carry your hopes, your expectations, because you sometimes can't even see how change is going to come about. Work through the program with me, and you'll begin eventually to start to see something is shifting, is changing. But there can be no quick fixes. Please remember that. You cannot have this quick fix, Happy Meal, McDonald's conveyor belt system of change. Because we're not just going after the stuff that has been affecting your relationship in recent months, in recent years. What we're really going after are patterns of behavior and scripts that often get set up back there in the past, typically childhood development. Are you getting it? Keep going back to this thing called childhood development, because that's where so many of the clues can be found as to what has shaped each of us to be doing life, how we are doing life as adults.
Send me a message. It's time to get your relationship back onto a better footing for your future. Let's do some work without shame and bring colour back to life. Send the email, send the message to me, Gary McFarlane, at the Kairos Centre, and let's begin to reclaim your quality of life.